alaikum. Good morning to all of you, and welcome to my talk. I'm Amjad Obeid. I'm consultant in medicine, and I'm the Chief Medical Officer of Bahrain Grand Prix. I was Chief Medical Officer of India, Azerbaijan, and lately Saudi Arabia. So having the video about license to kill from our two residents, so that does not mean they're going to have a driving license to race. It's another issue. So my talk is going to be motorsports medicine. Is it really something called motorsports medicine? Does it really exist or not? Let's just watch this video and let us say why we are really concerned about it. So this is one of the accidents. Okay, an accident happened, one of the races. The drivers in the car were almost hitting the cameraman. We've got marshals around. There were people sitting behind the fence. So motorsports is not only people are just driving the cars fast, having all the luxury. We as medical or doctors gonna cover all those events. So this is another, I'm gonna take you out of the whole, or out of this whole, how we can as emergentologists work and really use our skills, our expertise, and our knowledge to cover such big motorsports event or even big events as well. So, introduction. It's a unique subspecialty. It's an evolving one. There is no such an academic yet for motorsports medicine, but it's subspecialization. It's got lots of misconception that motorsports medicine is part of sports medicine. It can be, but also emergency medicine is really where most of the emergentologists around the world are the ones covering such major events. And how we as emergency physician, we're gonna exert our medical management and our expertise on track there rather than in our hospitals, in our ED. So priorities, what we need to know about motorsports. What mean, there's not only a doctor there covering a race, going there to see a car there, that's it. No, we need to have some kind of a background, apart from your medicine background. You need to know about the anatomy, physiology of the driver, what really goes wrong with this driver, how do we promote for safety. I'm involved in lots of research about safety issues, about the cars, how to make things more safe for our drivers, how to implement fitness programs for our drivers, and how to prepare our event, whether from trauma management or from even disaster preparedness as well. And of course, how to deliver a prompt medical intervention on site or on track. And of course, how do we, as doctors covering those events, how do we divide ourselves and put our teams? So when we talk about motorsport, it's not only Formula One, it is karting, it is MotoGP, it is rallies, lots of events, lots of races. So you can see this one of the rallies here. Okay, you can see this accident happens. Okay, the driver was going too fast, and you can see those spectators here. Unfortunately, no one died. The driver was fine. None of the spectators died. But before we go to event, so we start preparation of an event really long time before that. And we have to always look at the safety of not only drivers, of people also attending such races. Of course, the safety measures in this car protected this driver. He was not injured because lots of roll cages. He was wearing his helmet, wearing his safety gears. But of course, it was difficult to take him out of the car. So we go back to basics. Okay, what do I need to know as a doctor covering such event? What really happens to this driver is not anyone can go and drive the car. Not anyone can go and race. This is Lewis Hamilton actually in Bahrain wearing thobe and qatra. So what happens to the driver's body? How does the body of a driver really just kind of accommodate such a stress or such a very high speed event? So he's sitting in this position in a car, in a cockpit. We'll just take a Formula One as a kind of an example. So what happens, I'm sorry, okay. The physiology, his heart rate even goes to about 170, 190. Blood pressure actually increases up to 50% of the normal, and pulse rate as well goes about 160 to 200. So it's normal for him. This driver is athlete. He always fit to go and drive. His brain, he has to process lots of instructions per second, about 100 trillion instructions per second. with the speeds of about 300 kilometers an hour, he has to make sure that which decision to be made, because if he did the wrong turn or the wrong brake, he can even kill himself or kill others as well. So they're always trained that they have to be always up to that level. So his eyes as well, they have to make sure that they audit and they just eliminate whatever obstacles. You can see this is Michael Schumacher's car when he was driving the car. He goes up to a speed 260 to 280. He has to only to eliminate whoever is sitting outside the track, because it's lots of distractions on him. So that really gives you how much stress on the body of the driver itself. So the neck of a driver sitting in this position, wearing all his gears, his helmet, and his hands, something which support his neck, there is something called G-force, which always makes as if he's putting about a weight of 225 kgs on his neck while he was driving the race for about 3 hours or so. And very interestingly, because of the heat, almost the cockpit inside the car, the temperature reaches up to 65 Celsius. And he have every race driver lose about 3.5 kilograms of his weight in every race, because he sweats a lot. And of course, you can see all the drivers, they have to wear those uniforms which are thermal layers. If there's any fire, they will protect him from getting the fire or getting to burn for about a few minutes. So they lose a lot of fluid. They lose about 3.5 kgs from their body weight. I just said the heart rate can reach up to 170, and of course they have to take water during the event, which is before 1 liter. During the race, they have to put like a water in their helmet to about 1 to 2 liters during the race, and after this they have to replace all the fluid intake. Arms as well, whenever he's holding the arms, he's gripping it in a very, very tight way just to control the car itself. Takes about almost as if you're holding the medicine ball very tight for 2 hours. Needs a lot of strain on your muscles. Chest, you are holding it very tightly. You cannot just drive with one car, especially if you're driving a very, very high speed. So that needs lots of stress on your chest muscles as well. Abdomen, the same way. Your seating as well gives you this kind of a strain pattern on your body. Legs, whenever he wants to put the brake pedals, he has to almost press about 136 kgs weight. So that gives a lot of stress on his muscles as well, on his legs. Again, they're wearing feet, they're wearing fireproof socks, which also they become very sweaty and very wetty during the race itself. So how do we run F1, either in Bahrain or anywhere else in the world, and who shall we take care of? We take care of everybody, whether it's a driver, it's his mechanic, or even the spectators, people attending the race itself. So how do we I'm just telling about the preparedness for the next Grand Prix is going to be in next month in less than 3 weeks. So let's watch this video. This is just an accident happened, unfortunately, on 1970. There's a video here. Oh, it did not work. Okay, all right. So there was a driver which stopped, and the marshal wanted to help him, but he was not safe, and he was just actually the car hit him, and the marshal died. You can see this in this video. That was in 1977. Both the marshal died immediately, and the driver of that Formula One car. I'm sorry for this video. So whenever we take a doctor, it's not only taking a doctor from the emergency department or any hospital, just go and cover this race. We have to give him lots of rules and regulation, how to be safe, because we don't want him to go and get killed or even kill others as well. So that was a very unfortunate accident, which this marshal immediately died, and as well the driver. So we always tell them we have got some rules. You've got your emergency medicine or your knowledge with you in your mind, but you have some rules as well. And this is how we go and train our people. Rule number 2, you have to take care of your team. How do we take care of your team? Look at this accident here. There's just a small accident, okay? As a very simple one, the car stopped and the team just went to go and approach them. But they were not following the rules and regulation. They could have endangered themselves. This guy tried to pull them all away. If they did not pull them immediately at the same time, he pushed them. So they work as a team. They ran away, and it's a dangerous sport. It's a dangerous assignment for you. Not everyone can go. We should not send anybody without briefing them, without telling them what you should do and what should be done, what should be avoided. So how can we say that this medical team is going to be ready to cover a motorsports event or a big motorsports event at an international level? So we have, how can we say we are ready? We have to say, yes, we are okay that we can start the race. There are lots of strict rules. There is an appendix, which is called Appendix H in the FIA, which is the International Federation of Automobile, that all the motorsport around the world, they have to fulfill those criteria. We have to have certain number of doctors, we have a certain number of vehicles, the equipment checklist, we have to have it also with us, and we've got even officials coming and checking on every team, whether they have it or not. If there is no medical team on such big event, there will be no event, they will cancel the event. And many events actually were reported to be cancelled or even were just even postponed until they have the enough number or the proper equipments. Medical teams. Let me just give you an example of whatever we have, whatever I have in Bahrain. We have got, this is our deployment, we've got a map, we've got, this is the track itself, we've got vehicles and people around the track. I will just give you now a few examples. Around every 500 meters, if it's a circuit racing, we have to have somebody on track. That is decided by the medical doctor who's covering this event, and of course the officials of motorsports. We have subdivisions, lots of teams within the medical team. We have medical center team. Actually, we do have a kind of a small emergency department with a small trauma bay on track that we can do. We can deal with any trauma patients. We can stabilize patients, and we can also transfer them to the hospitals. We have got all the needed equipment for that. We have got an aeromedical evacuation as well, that we have to always do our training on that. We have got an extrication team that always help us to take the driver out of the car. And this is our extrication team in last race in ROC. We've got intervention team as well, which are vehicles that have to respond very fast to any accidents. Of course, you know this gentleman, he's one of our speakers, Dr. Adil. We have also people who are standing on foot. We've got the pit lane, what are the garages, people standing there, waiting and covering all the events. And I think those two people are familiar to you as well, Dr. Arif and Dr. Abdulaziz. We've got ambulances that you have to cover as well, the circuit or the track. About 11 ambulances in Bahrain cover only that race track. That every ambulance has to be an ACLS and has to be equipped with even trauma life support as well. So rule number 3, you have to be always safe, and you should be always pay attention to the track. Okay, you should not, of course, whenever we see an accident, we have to anticipate what injuries could happen. This accident happened to Alonso, which he had a fractured rib, but he was discharged home, then came back to Bahrain. After he flew from Australia to Bahrain, he had a pneumothorax, which was not discovered. Then he was even stopped from the race itself. Looking at the video, looking at how the accident happened, we have to anticipate our injuries. Spectators, we have got about 100,000 people coming and covering such an event. We have to prepare their medical coverage. We have to cover our disaster preparedness. We have to assess if there is any risk as well happening. So it's not only only a small clinic with a few first aid bandages. How do we prepare? We do simulations. We go on training on track. We do a fire on a car, how to take the driver out. We do an extrication exercises on car. They have to be tested. They have to be evaluated by the International Federation of Automobile. We do on-track as well simulation with a higher official as well attending it and assessing us. And of course, we do always an evacuation, and we hold our seminar, which is every year. We were busy in our seminar, and some of our colleagues also were just taking some photographs, Dr. Arif. And we have an everyday medical briefing for the whole team. It's about 190 people covering, and every day we debrief them and brief them about what is the agenda for the day. In KSA last month, we had a race of champions. We did the same thing. We had an exercise. We had a simulation exercise. We had a patient on track. We evacuated him. And of course, we covered Raleigh High last month. We did the same thing with aeromedical evacuation as well. So always pay attention to the track, even to the race itself, and always anticipate that there could be an accident happening. If you are interested to join the medical team, I'll be more than happy. Just send me an email, and can put you on our data list. Thank you very much, and that's it. Thank you very much.